welcome to this session of our distance training topic. For this session, we're going to cover our annual HIPAA update. And as in the past, after completing these here objectives, there's a form on FireManager to complete and submit. There's more details at the end of the presentation on that process. The various objectives we're going to cover is what is HIPAA. We're going to talk about the penalties, the various rules for security and the privacy acts, our obligations and as a town and as a employee of the town, policies, procedures, and we're going to do a few questions, common questions and concerns. So the acronym HIPAA actually stands for the Health Insurance Portability and Accountability Act. Pretty much this was put in place for various protections of health information, the sharing of information, confidentiality, etc. It was first passed in 1996 as part of the Social Security Administration Act, and as I mentioned, it does protect the confidentiality of patient information, personal information when it comes to health information for people. Security of protected health information, often referred to as PHI, and how we disclose it, how we use it, and electronically transmit it. Because sometimes we do have to share this information from organization to organization or person to person. And overall, this creates a standardized framework for doing this. Penalties for non-compliance. So obviously, if you don't comply with these various aspects of HIPAA, you could be civilly charged with $1,000 per violation, up to $25,000 per year, and that's for each requirement of the rule violated. Federal criminal, up to $50,000 and 1 year in prison for disclosing PHI, and up to 5 years and $100,000 if you obtain this information under false pretenses, meaning, say you want to know about a particular person and you contact a said organization, hospital, doctor's office, and pretend to be somebody else in order to get the information. And up to $250,000 and 10 years in prison if you obtain or disclose PHI and then sell it for commercial advantage, or for personal gain, or malice, or for being wrong intentions for somebody. Obviously a heftier fine there. Penalties for non-compliance. Liability may fall to the individual. What this entails is the town of Clayton will not say, oh, you're a town of Clayton employee, we'll pick up that $1,000 fine or that $250,000 fine. It is likely that the liability will fall to the individual, and in addition to that, disciplinary processes will take place, and this would definitely be one of those that fall under the unacceptable personal conduct. And per our personnel policy, any forms of unacceptable personal conduct termination can be done immediately. You don't have to have various warnings as people are aware of for unsatisfactory job performances, with those two being the main two personnel policy areas we deal with. The unacceptable personal conduct can be punished by termination after the first offense. There's not necessarily a warning process for that. This may also result in professional credentialing. So if you're an EMT or other certification, it is likely also that that certification or credential could be vacated, could be pulled from you. So what is considered your protected health information, or PHI? Individual identifiable data. This could be whether you say it, whether you write it down, or if it's in a computer database. These can consist of somebody's name, their date of birth, social security number, the address, and insurance information. Any past, present, or future medical condition, treatment information, various mapping information, longitude, latitude information, phone numbers and documents for insurance and treatment, and other individually identifiable data. With this data, there comes the privacy rule. The privacy rule is designed to protect information while allowing it to flow without impeding care of public health. As I mentioned earlier, sometimes we have to share this information for process of doing patient care, passing of information, certain benefits. We have to pass along information, meaning we may pass out a form for you to complete for beneficiary information. That's obviously protected information, and it will likely go from person to the one passing it out and to the other, another person that has a vested interest or is a stakeholder in that. A perfect example of that is when we do like our annual update of beneficiary information. We give our employees the right to fill it out, that night, turn it back in, and it immediately goes to admin. Or sometimes you'll fill it out and put it in a secure lockbox, and that information is accessed by admin. And then we obviously have the process as well of you coming directly to admin and completing it in person. Primarily implemented through policy, procedures, and education, and as we'll go through some of these as well with our HIPAA SOP SOG. These tools should ensure confidentiality and restrict disclosure. The security rule is protect same information when it's stored or transmitted electronically. It's designed to guard integrity, confidentiality, and availability through administrative procedures, physical safeguards, technical security measures, and transmission protection standards, which we're going to talk about these in detail. So who involved is covered by HIPAA. Obviously fire, rescue, EMS, because we're typically that first line of personnel that deal with this process. Then the receiving hospitals, and it goes to your physicians, Johnson County Health Department, and billing companies. So even the ones that don't necessarily have patient care contact also deal with health information and insurance information. So the billing companies have also are required to follow these regulations. So what are the obligations of CFD under the HIPAA? First of all, we have to designate a HIPAA liaison, and for our processes, the Deputy Chief of Operations, that position is the designation of the HIPAA liaison. So we also, along with the liaison, we have to determine who needs access and level of access of protected health information. With this, obviously, our personnel, as from firefighters all the way through the fire chief, at times, all of these levels could have access to this protected information just for the simple job duties we run, running these EMS calls, and seeing people that we don't know, getting that information. But even some of our own personnel, when we're dealing with benefits and things, typically with our own personnel, that's going to be limited to administration, fire chief, the deputy chiefs, and administrative support specialists is typically who has access for those records. We also must implement, train, and update staff on HIPAA policies, which is what we're doing with this presentation. And keeping records of this training is also done with our retention program with our record keeping. The security of records, all personnel records that may have this protected information is under lock and key with limited access. Also, if you are requesting to see like your personnel policy or whatnot, typically you can go see administrative support specialist. She'll unlock that drawer and hand you your personnel file. We don't just tell people, hey, go in the admin office, go into the drawer, and let you thumb through one by one the records that are protected. Develop and maintain a policy for misuse of PHI data, and again, this is all covered through our procedures and policies. And how we report, we also have to show a process of reporting violations. We have to also complete regular training annually. This is a HIPAA requirement. We have to safeguard records, computers, and oral protected health information with the verbal process. A lot of times you'll see that if we're on an EMS call in a big crowd, one of the easiest things to do there is tell the crowd to leave, disperse the crowd or whatnot, because we want to limit that the sharing of that information. There are some exceptions when it comes to that, and we'll discuss as we go through. We want to ensure patient and guardian understands our privacy practices. This is typically handled through EMS, and we don't necessarily on medical calls pass out a HIPAA form, because we will always transfer care to a higher level, and typically EMS will handle that communication aspect of having the patient or guardian sign a HIPAA understanding agreement or whatnot. As employees, we also need to know how the regulation impacts us, and signing a confidentiality agreement, this can be waived. The physical signing of an agreement can be waived with the completion of HIPAA training with the presentation, and that's how we do here. So when you complete this presentation and do that documented, formatted test, that takes the place of us showing somebody a signed agreement that, hey, this person agrees, by you doing this presentation, and the test is that agreement. So here's some privacy actions by CFD personnel. So here's kind of getting down to how we treat the PHI. So for instance, be aware of your surroundings during permissible oral disclosures to limit those who may overhear. Again, we want to be aware of who's around us. Like I said earlier, if we need to tell a crowd to disperse or get the unwarranted person, ones that are not part of the incident, away, that is definitely the preferred route. Typically, it's not our practice to store patient information in our fire reports. If any inquiry for patient information comes to us, we forward that to Johnston County Emergency Medical Services. And I believe the phone number, it may be listed later on in the presentation, but if it's not, the number to Emergency Services 919-989-5050. And at that point, you can request to talk to the Emergency Medical Services Division about a HIPAA process and any inquiries for that. But the more common inquiry we get is for like EMS reports, and a lot of times there we'll just refer them down to the Clayton Main EMS station here behind Station 1, and the phone number down there is 919-553-5493. Any documented PHI on scenes needs to be turned over to EMS where they can have record of it and we dispose of it per their set HIPAA policies. And that's typically done with our EMS reports. We'll pass a lot of information along from the carbon copy, or we'll even, if we don't have the carbon copy, we'll transfer the information to another form and give it to them. Report any inadvertent disclosures to the HIPAA liaison. So if you have any inadvertent, meaning if you own a call or at an incident and you disclose the information, and all of a sudden you realize maybe some people maybe some people that are around didn't need to hear that, simply just informing liaison of that, and our documentation can be done there in the event somebody comes up and makes a formal complaint. Recommend actions to improve privacy practices. Administrative record keeping. PHI will be associated with any injury and or exposure file. So again, like I said earlier, there are certain times we have to obtain this information from employees, and typically those reports, medical reports, are kept in the personnel medical file, which is kept in the Deputy Chief of Operations office under lock and key, with very limited access to that as well. Records are kept again under lock and key, controlled access, as we mentioned before. If you need access to your own file, again, they're hand delivered. They're not just, we don't give you access to the overall file, folder, drawer, and let you go through it and find it. Personnel with access to personal personnel information, we are required to protect that information with passwords, limited or official use, only viewing, and as far as another reminder, and this is a pretty good reminder for any whether you have personnel information or not, but securing of computers. If you walk away from your computer, it's always a good idea to lock that computer or log off or do something to protect it where somebody's walking by or sits down at that workstation. They don't see anything personal or protected information. Patient requests for medical records. Again, patient information, we do not enter that into fire reports. We typically will label our fire reports as either assistant EMS or EMS other. Ones that may request this patient information, patient may request the guardian, healthcare power of attorney, law enforcement, courts, insurance companies, etc. Again, anyone requesting medical reports of a patient shall be referred to Johnson County EMS. In-person requests, they can be sent down again to Johnson County EMS to Clayton Main Station, or phone requests can be forwarded to, and there's the number to the Johnston County Emergency Services in Smithfield, 919-989-5050. What disclosures are authorized? Obviously, information directly to the patient or guardian or healthcare power of attorney, for obvious reasons. I mean, you're talking to the person or the legal representation of that person. Required disclosures regarding abuse, neglect of elders, children, and or disabled. So we go on incidents and we see abuse. These are automatically authorized disclosures. We have to pass those along to law enforcement or EMS, but typically these are also going to be passed along to law enforcement for abuse. To report a crime or to avert a serious threat to health or safety of the public, we can disclose certain information. Data for research approved by an institutional review board, and these disclosures are still recorded, so they're still passed along to the liaison for documentation of disclosures. Inadvertent disclosures, these are disclosures of PHI or electronic PHI which should not have occurred. Again, the simplest thing for this is to report to the HIPAA liaison. Documentation will be done and actually passed along to other. Typically, any documented inadvertent disclosures are also forwarded to EMS, just so they are aware of it as well. Some examples of this: discussion about a patient's status or treatment were overheard by someone without a need to know. This happens often. We may be on an incident in a neighborhood, and the neighbor comes out and says, "Hey, what's going on?" That's why we pretty much tell them, "Hey, we can't tell them." Or this has happened a couple times where you may be done with the incident. Typically, the tougher incidents, codes or significant incidents, we may be outside around the fire truck and doing a tailboard critique. Just be cautious of who's around. You definitely don't want to have an inadvertent disclosure. It may just be better to if you want to get into the fire truck, to have those real quick debriefings or whatnot. If it can't wait to get back to the firehouse. Patient information entered in a fire report. Again, this is a more common one. Just a quick notification to the liaison. We'll handle that. A lot of times there's nothing we can do about it, especially if it gets into on the CAD side, MCT side. As far as in firehouse report, we have some control over it. But if it's been put into the CAD side, we can't do anything if it's in the notes section. Which at times, if you'll note, there's sometimes information put in there out of our control. So if the telecommunicator, the dispatcher, or another agency or person from another department puts items or information in there, that's literally out of our control for that. PHI left behind and discovered by someone else. So you're on the scene, you've got your notes, you've got your clipboard, and say you leave the scene and you leave your clipboard there, and a citizen brings the clipboard to the fire station. Say, "Hey, you left this on the scene." Obviously that needs to be reported as well and documented. The incident environment is not as controlled as it may be in constructed clinical treatment areas, where you can go and see various signs. Please wait here for next available assistance or whatnot. So with this, we have to be very cautious on verbal reports to other healthcare providers, and necessary treatment discussions may be overheard by others in our treatment area. We must still exercise reasonable efforts to limit this ability of others overhearing this PHI. And as I said earlier, we can do that simply by asking people to move out of the area, or if it's possible, possibly even moving the patient from the public area into a secure area, or even to the back of the ambulance to gather this information. Where reasonable effort is used, these disclosures do not have to be logged. So if you've got those situations where you made an effort, but you're in the middle of a grocery store, and you absolutely can't move them somewhere else. I mean, you've done what you can. Those things, that's literally, I guess, a cost of doing business, as long as a reasonable effort is made. Limiting the inadvertent disclosures, again, this is just some, again, kind of putting it on paper what we've already said. Ask spectators to move away. You can position yourself to obscure the view, minimize the volume of speech necessary to discuss these. Hold no discussions regarding your patients or your calls with persons who have no legitimate need to know. Now, that's one of those things, and we often will talk about calls as a venting process, or as just a general discussion, but we still need to use a lot of caution with that, where we limit on what we talk about on those calls, and again, limit who the person is, where they live, especially names or addresses and things of such. Have necessary discussion in protected areas when possible, as we mentioned before. So the contact process is here. You'll contact the HIPAA Liaison if you receive requests from government agencies, subpoenas, or search warrants. Receive a complaint. Personnel are prohibited from retaliating against anyone who makes complaints. That goes back to your personnel policy. So if you get a complaint of someone, that definitely needs to be forwarded on. If you make or know of an inadvertent disclosure, and also if you have any questions about the HIPAA process. So some common disclosures for field personnel. Again, disclosing to assisting receiving healthcare providers is unrestricted. This, so EMS arrives on the scene of a medical call, we can immediately transmit that information to them verbally for complete patient care. Disclosure law enforcement on scene at hospital is limited to non-PHI, such as unit designation, name, etc., except for emergency disclosures. Law enforcement's a little different, because a lot of times they need to know. Other common disclosures: family and friends present during the encounter may receive only necessary information to effect proper patient care, or information specifically authorized by the patient. If the patient is alert, conscious and alert, the patient must authorize any disclosure. So in order to pass along information, we have to ask the patient, hey, do you want me to tell your significant other or your friends or whatnot? If they're unconscious or altered mental status, or if the treatment makes patient inaccessible, disclose only to the persons necessary to effect patient's care, and limit only necessary elements, and disclose only if you can reasonably infer a patient would not object. Sometimes we need the patient information or share certain information. A common one here, I would say, would be cardiac arrests. Obviously there's sharing of information, what we're doing with the patient, with the family, such as, hey, look, we're breathing for them, we're pushing on their chest, and this is to me, it's a common sense thing. You're letting that family member know what's going on with their family member. And then wrapping things up, some common questions and concerns. So let's use a scenario: you've been dispatched to an address that you can't find. You have the patient's name in the dispatch information. Because the patient's name is considered PHI, can we use this? We can, when it's necessary to effect patient care. It is permissible to disclose this. Along with that, is it permissible to ask a neighbor how to find the Smith residence, or John Smith's house? With that being said, if you ask where John Smith lives, and the neighbor says, oh, right there, and points to the house, you can't turn around and say, okay, good, we'll go in there for a stroke call. You just need to find the information and go from there. A lot of times that neighbor will ask, hey, is Mr. Smith okay? It just needs to be professionally, professionally inform them that information cannot be shared. It is not permissible to disclose the complaint, suspected patient status, etc. Can EMS give me the diagnosis or outcome of patient I responded to? This information being relayed to a treating healthcare provider with whom patients established a relationship. It is also a quality assurance measure to help inform future treatment and care decisions for similar patient encounters. It is permissible to disclose this to responders who were on the call in secure surroundings. So again, we typically see this in cardiac arrest incidents or these significant calls where we take care of them. We like to know the outcome of that, and typically that can also be handled through the liaison as well, because they can directly communicate with EMS representatives and find this information out as well. Physical security initiatives, these were somewhat mentioned before as far as locking computers and so forth, but along with those, keep facilities secure, doors locked, bay doors down. We protecting our MCTs is probably not a bad idea. Even a lot of times our MCTs are left on apparatus, and we try to keep them in sight, secure them. But even if we decide to lock them, could be another means for physical security. Maintain custody, security of electronic devices, laptops, desktops, again, secure EMS vehicles. Identify and or report suspected unauthorized persons on EMS property, incident scenes, etc. Transfer printed records directly to staff. So again, this is handling it from person to person instead of kind of giving it to somebody that doesn't have a need to know. We want to keep building access codes confidential. Again, this is not just for HIPAA purposes, but just for an overall security process of the building. Do not attempt to save PHI or other devices on personal laptops, phones, etc. So this is again a common sense thing, but we want to keep everything on town property, town devices. Don't try and get ahead of the game and load information on personal information to do work from home or whatnot. And complete any electronic forms on department computers, as I just mentioned. Emergency disclosures. This is one of the toughest HIPAA issues to manage. It's typically with law enforcement, generally not covered, generally not HIPAA covered entities. These often, law enforcement officers often have legal rights to access PHI. They often need to know to do their job, and along with that, law enforcement officers are often trained to extract information from those who have it. And big picture, we like to have relationships with law enforcement we like to maintain. So if they're asking, it's typically for a pretty good reason and that they need to know. We do prefer the disclosure process to go through EMS. So one thing we can do to kind of limit our liability or whatnot is pass that information on EMS. If law enforcement is asking for this information, refer them to the EMS unit on the scene, and that's commonly the practice anyway. Because if we're to the point where law enforcement arrives on scene, typically we're clearing the scene or busy working the scene still. But that's an easy way out for us. Refer them to the EMS personnel, typically the EMS supervisor, if he or she's there, and then they can handle that whole disclosure process. Again, here, it's permissible to disclose this information when they're trying to locate a suspect, fugitive. If the patient admits to EMS participation in a violent crime, again, kind of goes back to the abuse and neglect process we talked about earlier. And if we believe the patient has escaped from prison or other lawful custody. We obviously would want law enforcement involved with that. Here's some limitations, name and address, date of birth, social security number, type of injury, date and time treated. Again, this is typically handled through EMS, and bottom line, if they ask for specific information, they typically have a right or a need to know. Example, the name and address, dates of birth, those are very common. That's very common information they need to run somebody's name and gather information they need for their part of their job. Here's other just distinguishing physical characteristics for law enforcement: height, weight, eye color, scars, tattoos, facial hair. Again, as you can see with these characteristics, what they would need these for in identifying personal information. To prevent possible immediate threats to individuals or the public, including general public, an emergency disclosure can be made to anyone reasonably able to reduce the threat. So again, this is law enforcement. This could be 911 operator, owner of a business against which patient's making a threat to. Again, these typically, if you have this level of an incident happening, typically there's going to be law enforcement involved, EMS supervisors, etc., fire department supervisors. So we can utilize those personnel for these disclosures. Then just to recap, abuse or neglect have to be turned over. So we can report to EMS. They can report it to a hair care facility. It supplies when disclosure is necessary to prevent serious harm to the individual or other potential victims. And special reports are also created by EMS so that their administration personnel can follow up with. And the HIPAA policy does not intend to keep everything tight-lipped. As I mentioned before, the general nature of certain incidents, the venting of general discussion of events is expected, and these discussions are okay as long as we don't share information that's protected. We don't necessarily need to share their names and their social security numbers. Again, audience to surroundings is given attention to the audience and surroundings. And when we're using as learning tools, often you'll see in EMS classes or Con Ed sessions, we'll take incidents and use those incidents for learning tools. Even during our annual updates, we'll share particular types of injuries and illnesses, but as you're aware, we don't share the personnel's name, their address. It's pretty much what type of incident it is, just so we use that as a tracking tool and a learning tool. Again, to reiterate, the HIPAA policy does not intend to prevent personnel from having critiques or critical incident stress debriefings. And even in those type of critiques and debriefings, specific information and details about that call is shared, but the protected health information is not typically. Typically, it's those times to share what actions took place, how it's affecting people, etc. But HIPAA does not prevent personnel from having these critiques or debriefings. These are definitely needed for the care of our personnel and processes we go through for those significant calls. Compliancy, again, practice should allow care, ensure the patient's privacy and safety, and comply with laws. Compliance with the Town of Clayton Fire Department HIPAA policy is a condition of employment, meaning you're an employee of Town of Clayton, the fire department, so you have to abide by this policy. Non-compliance will be handled through personnel actions. Again, these can be handled through written warnings, probationary actions, and or termination. As we mentioned before, With the personnel policy, typically actions are handled out of two categories, either unsatisfactory job performance and unacceptable personal conduct. The unacceptable personal conduct per personnel policy, again, you don't have to have written warnings for violations that fall under that category. People can be terminated or demoted or put on probation at the first issue, where job performance actions, a lot of times those are given a warning about and follow that process. But again, violation of these or being non-compliant for this can cause termination per the personnel policy. And along with being compliant with HIPAA, again, we have to designate a liaison. And for our processes, the Deputy Chief of Operations, myself, is that contact person. You have my 24-hour cell phone number listed here, 919-201-4505. If I do not answer, obviously you can leave me a voicemail. My email also goes to my cell phone. I have access to email via my mobile phone, so you can email me as well, jdean@townandcollectnc.org. I just also keep in mind, technically the emails could be subject to other disclosures, so the preference is calling me in person or coming by my office, talking to me in person to report any of these issues. All inadvertent disclosures should be reported immediately upon recognition. And finally, to wrap everything up, to receive training credit for this presentation, just as with other distance training topics, is simply log on to FireManager, complete the HIPAA training form. This is accessible by clicking on the Forms tab in the toolbar. There will be a current year HIPAA training refresher training form you'll see. When you log on to it, multiple personnel can be listed on one form. When you complete this, when the feedback is given, when notification is given that a form has been submitted, it's reviewed, the answers are reviewed, feedback's given. When it's submitted back, the submitter, everyone who submitted, will be notified of the feedback. You do not have to complete a training report. The forms report can be used for that, and I will handle entering the information in the Firehouse. Created a single training topic for that, where I can just add everybody's name into it, so it's easier to track if somebody's had the training or not. Training hours will be credited 1 hour. This presentation is around the 30-minute mark, little more than 30 minutes. But you can view the presentation, and then gives you a little extra time to finish the actual test. The deadline for this training is by the end of April. And as usual, if you have any questions or problems with the test-informed presentation, or if you need clarifications on the HIPAA process, or other comments about the policy, feel free to give me a call. Thank you for joining us for this distance learning training. Have a good day.